Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. For another segment, we're going to have a conversation this morning about hearing loss. You know, by the year 2030, all baby boomers will be older than 65. Now, joining us on the program this morning are Dr. Leslie Soilis and Tina Soika of HearingLife. They're joining us here to talk about the various ways that healthcare professionals can be prepared for an increase in senior patients that might have hearing loss. Welcome to the program, both Dr. Soilis and Tina Soika. Thank you.
Thank you for having us.
Now, Dr. Soilis, a bit of background. What was it that fascinated you about hearing?
So for me, hearing and understanding hearing loss became very personal because I was born with hearing loss. Mm-hmm. And as a child, I was in and out of an audiologist test suite. It fascinated me as I was trying to understand why I couldn't hear certain things and why I could hear other things. So hearing is really what is connecting us to the people in our world. Mm-hmm. And I learned firsthand that when I could not hear well, that it was affecting how I was able to really engage and interact conversationally with people around me.
Tina, I've heard that people can be hearing perfectly well their entire life and then begin to experience hearing loss, and it affects their speech.
Sure. I mean, you can have great hearing, and then as you get older, especially as Leslie said, people in their 60s, a third of people in their 60s have hearing loss, and so it can affect the way you communicate because you're not hearing sounds the way you used to. So it certainly can. It also can isolate people. They can experience depression as a result of not being able to hear. So it's a pretty debilitating disorder.
You know, as we approach our 60s and 70s, certain things begin to happen that we're kind of reluctant to talk about. Doctor, have you experienced people that may be experiencing hearing loss but are in denial or maybe reluctant to even talk about it?
Oh, absolutely. And one of the reasons I believe that people aren't willing to just immediately take this on is because hearing loss occurs very slowly over time. And people try to adjust to the missing sound information by lip reading, by really paying attention to the sentence context. Mm-hmm. But over time, it's no longer something that they're able to do efficiently or effectively. I'll always tell a patient, if you woke up tomorrow with the hearing loss that you have today, going from normal hearing to what you have today, you would be on the phone so fast, calling your doctor saying, I don't know what has happened. But because it occurs slowly over time, I think it's easy for people to just think that I'm okay, it's not that bad.
Tina, is hearing loss a guarantee as we enter our 60s and beyond? Is it a guarantee?
Well, it's not a guarantee, Neil, but a third of the people over the age of 60 have some type of hearing loss. And then when we get to our 80s, over half of us will experience hearing loss. So it does progress as we age, for sure.
And I can remember taking those hearing tests in school and it being, no big deal. What about patients who may be apprehensive about being assessed? Maybe they think that there's more involved in it than there actually is.
So one of the things I love about my job is I never hurt anybody. When I do a hearing test, it is a very easy, very simple process of asking my patients to just raise their hand anytime they hear the beeping sound that I'm presenting. And I just record those hearing levels on a chart, and that provides us with the essential information.
Tina, when someone is experiencing hearing loss, do you always tell them, we can get you a hearing aid, or are there some situations that the person is just going to have to accept that there's no reversing and it's going to finally go silent?
Well, Neil, it depends on the individual. It depends on the hearing loss. There are some physical conditions that affect hearing loss. Many of us over the age of 60, the hearing loss that we're experiencing is nerve hearing loss, which means the best solution for that type of hearing loss is hearing aids. But what's important is that the person needs to go get their hearing assessed, and then that hearing care professional will help determine what's really going on with their hearing and what the best solution for them is.
Doctor, not all doctors are audiologists. Regardless of the specialty, your patient more than likely has ears. Speak to the doctors who may not be as versed in catching those subtle nuances to let them know that their patient might be, having some loss.
Absolutely. So as Tina mentioned, it is more likely than not likely that as people age, they will experience hearing loss. Therefore, it's essential that they obtain a baseline hearing measure. Very few primary care doctors have the capability in their practice to be able to evaluate that. And that's where HearingLife is able to provide that essential information to the doctors. It's just a very simple referral over to a HearingLife center to have that complimentary baseline hearing measure done.
Is HearingLife availability nationwide, or are there certain places where a patient needs to travel to in order to be assessed or treated?
Well, we have over 500 hearing care centers all over the country, and if someone wants to find one of our centers, they can go on our website, HearingLife.com, and they can find a provider near them.
And I thank you both, Dr. Leslie Soilis and Tina Soika. Thank you both for joining us here on Health Professional Radio this morning.
Thanks for having us.
Great.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.